If it's a tear in the supraspinatus or infraspinatus or one of the rotator cuff muscles back here, we would then use the laser over those areas to start to heal and repair the tears in the rotator cuff muscle. If you've hurt your shoulder, have a rotator cuff tear or a slap tear like me, I just acquired a slap tear a couple weeks ago and a broken hand, but I'm going to show you how we would laser a shoulder injury, okay? And this cold laser therapy will work for almost any type of injury, except if it's a complete tear. If it's a complete tear, you're going to need to have surgery. But if it's a partial tear in the rotator cuff muscles or the cartilage, which is a slap tear, okay, it's the labrum tear. So the labrum is a 360-degree cartilage that goes all the way around the shoulder joint, even underneath the armpit, all the way around. A slap tear is when the labrum tears up here on the top, either in the front or in the back. So what we do is we start out doing cold laser therapy at 1,000 hertz because that's going to help reduce the inflammation. It's also going to help reduce muscle spasms and also pain. And then after a couple of treatments at 1,000 hertz, we would then switch the laser and go towards healing and repairing and more of a stimulatory effect. Right now, at 1,000 hertz, that's more of an inhibitory effect. So we want to just calm the pain down and the swelling down in the beginning. So when I first had my slap tear, I used 1,000 hertz around the labrum itself right here, and then a little bit here in the rotator cuff muscles. And then after a couple of days, when the pain started getting better and I was able to get my range of motion back, I then switched it to 5 to 250 hertz because that focuses more on the ligaments and the cartilage and healing and repairing the soft tissue. So the first few days, 1,000 hertz. The second week or third week, you're going to do 5 to 250. The lower the number, the deeper the penetration of the laser and the more of a healing effect. It's going to actually heal and repair soft tissue damage. And that's pretty much how we treat a shoulder with cold laser therapy. And again, if it's a tear in the supraspinatus or infraspinatus or one of the rotator cuff muscles back here, we would then use the laser over those areas. Same protocol, starting at 1,000 hertz and then moving on to 5 to 250 to start to heal and repair the tears in the rotator cuff muscle. Luckily, he doesn't have a rotator cuff tear. He doesn't even have a labrum tear. We were just using him as an example. I'm the one with a labral tear, but I just wanted to show you how we can treat a slap tear or a shoulder injury effectively with cold laser therapy. Thanks for tuning in, folks.